Welcome back to the 17 News at Noon podcast, where we share your news on your schedule.
Working in the spirit of the Golden Empire, this is 17 News at Noon.
Good afternoon, and thanks for joining us for 17 News at Noon. I'm Nicole Gitsky. We begin with another grim milestone in the country's efforts to fight coronavirus. According to the latest numbers from NBC News, the U.S. reached a record number of cases and deaths from COVID-19 on Monday. The U.S. now has 15 million positive cases since the tracking began and over 284,000 deaths. California has had the most cases of any state with over 1.4 million positive cases this year. Texas, Florida, Illinois, and New York round out the top 5 states. And here at home, a shocking surge in coronavirus cases. Public Health reported another 1,000 people have been infected with coronavirus in Kern County. We've also learned of another person has died from the novel virus. A vast majority of cases reported today are from people who've tested positive after Thanksgiving. Since the holiday, nearly 3,800 people have become infected with the virus. On average, about 500 people are getting infected each day. That's about 3,500 people a week. If trends continue, we could surpass our previous summer surge in a matter of days. Meantime, the focus remains on our hospitals as they continue to fill with COVID positive patients. Since data shows more than 200 people are in the hospital with the virus, just a month ago, only 22 people were in the hospital with COVID-19. 47 people are fighting for their lives in the ICU. And that alert that just popped up on your phone, that is an emergency alert going off right now. State officials say that alert has gone out to the San Joaquin Valley region, reminding residents of the regional stay-at-home order. The alert reads, a public health stay-at-home order is in your area. COVID-19 is spreading rapidly. Stay home except for essential activity. Wear a mask. Keep your distance. State officials say the message is encouraging residents to stay home to help stop the spread of the novel virus. Now, after record-breaking numbers and following the news of this alert, Dr. Mark Ghaly is set to speak and provide an update on the spread of the virus throughout the state. Now, he is not ready, but we will bring him as soon as he is available. Now, in the meantime, newly released documents suggest that the FDA will approve Pfizer's coronavirus vaccine for emergency use authorization on Thursday. The documents posted on the agency's website state the vaccine meets its criteria for success. Research data shows the vaccine was 52% effective after the first dose and 95% effective after 2 doses. Once authorized, Pfizer could begin shipping vaccines by this weekend. Now, testing is still an important way to help get the coronavirus spread under control, and Kern Public Health has an all-in-one place where you can find the nearest testing site. Now, you can find an interactive map on the Kern Public Health website. It shows where you can find paid COVID-19 tests for free, including sites that offer a $25 gift card. You can also click on each testing site to find more information on appointments, testing dates, times, addresses, and contact information. Just go to kernpublichealth.com and click on the COVID-19 section. Public Health says they have handed out over 5,200 gift cards so far. And the Kern County Latino COVID-19 Task Force is holding several free testing sites this week. Today, the organization is giving free tests at Standard Park in Oildale. That's at the corner of East Minner Avenue and Doyle Street. Testing started at 11 a.m. Free face masks will be given out courtesy of Adventist Health. No appointments are required. Now, take a look in your education news. News broke late yesterday that all students in the Tehachapi Unified School District will return to distance learning immediately. Now, according to a letter posted on the district's website, the change is due to staffing capacity and not because of the recent stay-at-home order or Kern County's tier status for COVID. The school and district offices are closed for in-person services, but will still be available by phone, and that's according to the district. Tributes are pouring in for a national hero. Chuck Yeager, the first pilot to break the sound barrier, died last night. Yeager's career began in World War II, flying P-51 Mustangs. He was shot down over France and evaded capture. Then he went on to break the sound barriers. He flew out of the Muroc Air Force Base, which is now Edwards in Mojave. At this time, no one knew if a human could even survive such speeds. His push past Mach 1 was captured in the movie The Right Stuff. In 1975, he retired as a general, but came out of retirement at the age of 74 to break the sound barrier once again. We'll have more on his life coming up tonight on 17 News.
Welcome back on this Tuesday, and I want to talk about weather. You know, this morning on Sunrise, we were talking about the disturbance to the south, and we were thinking that the rotation of that would not bring clouds into Kern County, or very little. Well, guess what? Mother Nature had another say in this, and again, we were thinking it would push a little more south. Well, it didn't. So these clouds are going to be around today, so a mix of sun and clouds for the rest of our day here. 66 in Sacramento, 65 in Fresno, and then we're looking at 70s and 80s to the south. Now, along the beaches, large waves expected today. Wave breaks between 16 and 22 feet with higher sets at 25 feet, and that's why there's a high surf warning in place. But a warm day at Pismo, 79 degrees. So today, we'll call for partly sunny skies, a light wind, 65 in Bakersfield, Delano, McFarland, 64 out in Maricopa. I still think we'll see the temperatures. And then for the mountains, partly sunny, an east wind, 10 to 20, 59 in Frazier Park, 62 in Tehachapi, 70s for the Kern Valley. Red flag warning due to fire danger still in place until 6 p.m. tonight. And then for the desert, partly sunny, northeast wind, 10 to 20, and 67 in Mojave. Here's your extended forecast. And tomorrow, 68, and we should be looking at sunny skies. And then with the systems approaching out of the north, some clouds for the weekend. A little bit cooler, upper 50s by Friday, lower 60s on Saturday. For the mountains, tomorrow keeping in the 60s, and then cooler weather on the way as we round out the work week by Friday, right near 52. Some clouds for your weekend as well into early next week. And then for the Kern Valley, lower 70s through tomorrow. Your coolest day coming on Friday with the upper 50s. And then for the weekend, looking at some cloud cover, but temperatures will be comfortable and in the 60s. So expect some of those clouds to be around most of today.
Okay, Dr. Mark Ghaly is ready to speak. Let's send it over to him right now and hear what he has to say today.
It was just 2 weeks ago, 55% increase in that overall test positivity, another direction that we hope to turn around as soon as we can as a state. Next slide. We've been talking a lot more about hospitalizations and ICU capacity, really using these as metrics, the ICU capacity in particular as a metric to define our actions across regions in the state. And just a global perspective that we've almost 71% increase in the last 14 days for hospitalizations, our highest number ever for COVID hospitalizations at just over 10,500. And just in a day, having over 450 new patients hospitalized overall. That is not just new people hospitalized, but when you account for those who've been discharged with COVID, the sort of increased number of patients hospitalized is increasing rapidly. Similarly, for ICU capacity, we've seen a nearly 70%, 68.7% increase in ICU COVID hospitalizations over the last 14 days. Next slide. So the governor and I have talked to you a bit about the regional stay-at-home order. We have 5 regions across the state. These regions are what are known as the health officer regions. We have a number of different ways of segmenting the state for various purposes. And although I think we've fielded many questions about why these regions are, from a public health perspective, have some common features. They end up also illustrating how some of our delivery systems, our healthcare systems, work together across counties. Indeed, there's no perfect way to design regions in a state this size. So you've used something that has been used in other areas before. And as you look at this map, we see that certainly the southern part of the state, the Southern California region and the San Joaquin Valley regions are really seeing significant load in their ICUs from COVID, and therefore have a small remaining percentage of ICU beds open. As you move farther north, you see higher percentage of beds open, but even in those areas, some significant concern. And I'll remind you that 5 counties in the Bay Area have elected to go forward with the state's regional stay-at-home order framework, despite having greater than 15% ICU capacity. I think it's a recognition. I applaud this recognition that the sooner some of these changes go into effect, the hope that the impact is greater and that we can shorten the time that these orders are in place. Next slide, please. So why a regional stay-at-home order? The fact is that transmission is now so widespread across our state that most all non-essential activities create a serious risk for transmission. It's also based on our past experiences in March when we flattened the curve. I'll remind you that in March, we didn't see a significant surge in this state. Our efforts were early, decisive. We all did it together, and we were able to, frankly, keep the curve down, keep it flat. We didn't see a big bump. In the summer, though, we did see a significant bump, smaller than the one we're experiencing now, and we saw how additional restrictions were the path forward to get through that. You might also ask, well, why the focus on ICU beds? Just to paint a bit of a picture for you, an intensive care unit bed is that bed that has such specialized staff and equipment, not because we don't have the equipment and beds enough, but we're worried about that staffing component. And on general hospital wards, where we have significant burden as well, but not nearly as much in our ICU. In the ICU settings, we know that nurses and respiratory therapists and other clinical leaders are not just hour by hour making changes to a patient's care plan, but really minute by minute. The need to monitor breathing machines, patients who are intubated on ventilators, the need to make sure that patients' kidneys are functioning well, that the heart is pumping enough blood to the rest of the body. Those are decisions that happen in real time and fast-moving decisions that we can only spread and stretch our ICU professional capacity, our nurses, our physicians, our respiratory therapists, our other healthcare personnel, stretch them so far before we're not able to deliver the kind of care Californians have come to expect out of our high-quality healthcare delivery system. So for that reason, we have taken a particular focus on the ICU, that we know that ICUs are not just called to take care of patients with COVID, but also patients with heart attacks, strokes, other serious conditions where that
and then go to break.
Minute-to-minute fine-tuning is necessary.
All right, we just heard the latest from Dr. Ghaly. Now he is talking about the spread of coronavirus here in California. He did mention that we have seen a 68.7% increase in ICU capacity in the past 14 days. Now, he is talking about other things, including why the San Joaquin Valley and Southern California are on those specific stay-at-home orders and why it is so essential that we stay home in order to combat the spread of coronavirus. Now, you can continue watching his whole live stream on our Facebook page and on our website, KGET.com.
Working in the spirit of the Golden Empire, this is 17 News at Noon.
The 17 News at Noon podcast is a production of KGET and Nexstar Media Group. For more on all of the headlines in today's show, head to KGET.com.